Hello, friends. This is Jeff Carter with another COVID-19 U.S. case update. It's actually going to be the final update of this type for a couple of reasons. One, the CDC is discontinuing a data set that I have relied upon. And two, I'm just going to be focusing on the state-by-state updates moving forward. I actually think that that's more relevant and actionable to people's lives anyway than these broader U.S. updates. So with that, let's go ahead and go ahead with this update. Once again, thank you for watching. Please like, subscribe, and click the bell icon to be notified, and share this video with anyone who may find it interesting. All right, the number of COVID-19 cases the CDC is reporting in the U.S. as of yesterday at 4 p.m. Eastern is 746,625. They actually changed the data, and it's mostly the same data, except there's this weird chunk right here. I think it's just a quirk of the data. I think when they were migrating, something happened with the numbers here, but every other number in this chart is basically exactly the same as it was before, and for some reason these are just missing a chunk right there. So not exactly sure what happened, but it's mostly the same. So no worries here, especially this data up here is it connects well with the data that was previously being reported. So I'm not too worried about the data being messed up or anything like that, except for just those two bars. Okay. The difference that the CDC is instituting as of April 4th is April 14th, I'm sorry, is that they're actually going to be including probable cases and deaths moving forward, whereas before they actually required confirmatory laboratory evidence. In other words, actually passing a test for COVID-19. You can read about this. I'm not going to go into too much more detail, but here it is if you want to pause and read through that. Okay, here is the daily growth in cumulative cases. And this is where I presented before. So you see that the growth rates have trended down a little bit since the last time I presented, but then they've leveled off. Now, we want to see these rates trend to zero, because when they hit zero, we know that the cumulative cases have hit the plateau. Obviously, we're not at zero yet. We're sitting at about that daily rate is about 3.6%, which, let me do math real quick. That's about it's about a 20-day doubling period. So it's slowed down considerably from, obviously these rates up here, but we still would see those rates double in about 20 days at the current rate. This is the new reported cases. You see, these have leveled off pretty well. I think it's been a long enough time period. We can say that's pretty strong leveling. Okay, and just a reminder, this is not based on date of onset, which I will get to later. This is based on the actual day that the case was reported. So the date of onset can actually be expected to be even further in the past. So this is a pretty strong trend suggesting new cases have leveled off. There's where the prior time that I presented this data was, so you can see that it's come down since then. Here are the growth rates. Again, this is where it was presented the last time. Sort of hard to see in this chart, but because of all the volatility in the daily growth rates before, but you can see, it's right at around 0% growth. One positive, very positive sign here is that the 1 day percentage growth rate has started to come down again, which suggests that these longer moving averages will follow. If this line stays down, then we'll see those longer moving averages start to trend down as well. And as those of you who followed me know, I like to look at the 7-day moving average to get a better idea of the trend. So this 7-day moving average of that daily growth rate, you see that there was a nice strong downtrend in the growth rate for a few weeks there, and then it's just leveled off. Obviously, that's not what we want to see at all. In order for the cumulative cases to reach a plateau, new cases actually need to hit zero. For new cases to hit zero, we need to have strong negative growth in new cases, and we're not seeing that yet. So this is what we want to see. All right, not seeing that yet. This is a data point I haven't presented before, but I wanted to include this because it's a really important caveat. This is the amount of testing that's being done by CDC labs, which is not very many, and then by public health laboratories, which is a pretty high number here. But we certainly need basically, and I don't know exactly where the remainder of these, for a confirmed COVID case, you would have had to had it tested. So I would assume that when it says U.S. public health laboratories, the remainder of the tests would be being done by hospitals. But as far as the tests that are being done by public health laboratories, we're certainly seeing that level off. And it's a little bit, it gives me a little bit of pause on the new case data, knowing that the testing, at least in the public health laboratories, has leveled off. Now, again, I'm under the impression that there must be data missing because this 331,000 is not the 750-ish thousand that we have of total confirmed cases now. So this leveling off, though, we certainly do not want to see a leveling off of testing. We need to know how many cases we have to have accurate policy decisions being made. Okay. Now, regarding this date of onset data that those of you who follow me know, I love to see the date of onset data because I felt like it would give us a good viewpoint ahead of the reported new cases to determine if there might be an inflection point. I was looking for that where I typically would find it, and it wasn't there. So eventually I found a page that was reporting like old COVID-19 data, and this is the notice on that. It says the data on this page was collected earlier in the outbreak. Due to the ongoing community spread, this information is no longer relevant to understanding the current situation. Now, there is information on this page that is not relevant. I have not presented that to you because I've thought it was irrelevant for a long time. However, the date of illness onset data I find still to be very relevant, and unfortunately, the CDC is no longer going to be reporting that. So I'm going to do this final update, and then unfortunately, I will not be presenting that data to you in the future. But again, I do feel that the state data is quite a bit more relevant and actionable because people can watch this video and know what, might be good policy or even individual action to take in their own individual state. All right, here we go. The COVID-19, so again, this was discontinued on April 15th, so this is the latest data that we have. It was 349,000 that had an estimated date of illness onset. At that time, it was 52.8% of total cumulative cases. It's obviously decreased because we've had cumulative cases reported since then, and this has been discontinued. So, but it was a very good sample size when it was discontinued. So the shape of this curve is pretty reliable, in my opinion. So we do see a nice leveling off in this data set. Here is the data set as I reported it previously. It's been quite a long time ago now, April 13th, so about a week ago. And I'm going to make room for the new data. Here is April 14th new cases with date of illness onset. April 15th new data. And finally, this is April 16th, but it's actually the data that was as of April 15th as of 4 p.m. Eastern that day. So, and that's going to be the final day before this data set was discontinued. So, we can see here that the peak from April 13th, which I have circled right here in red, is the same peak that we have as of the date of discontinuation. So pretty good information there to suggest that the shape of this chart is not changing much and that the peak is not moving too much further into the future. I do expect it to make a new peak here, but it might take it some time before it does accomplish that. So I am thinking that this is roughly like April 3rd might actually wind up being the peak in new cases. Now that is if we continue strong mitigation policies and intelligent relaxation of those policies. And basically what I mean by that is we really need to test in order to get people back to their normal lives. We can't just reopen without being intelligent about it. And as long as we are intelligent, I think that we might see the peak of new cases was about April 3rd as far as nationwide is concerned. All right. This is the logarithmic chart, which you'll recall, as long as this was a straight line, that signaled that exponential growth was basically continuing at the same rate of growth. And it pretty much did that for several weeks there, and then the growth rate really started to decelerate. So just to show you, this is the chart that I presented before on April 13th. I'm going to draw that red line so we can see how the cases have changed. And there are the new cases. So you can see just not much growth over that red line. Very positive to suggest that the growth rates have declined and are new cases pretty reliably are leveling off here. Now, we really would have hoped to see like a peak and then a massive decline. It looks like it's going to be more of a plateau and then a gradual decline, but obviously it's great that it's leveling off. We really want to see, obviously these new cases need to head to zero, okay? And the only way that's going to happen is continuing mitigation policies and intelligent rollout of relaxation of those policies, okay? All right, these are the growth rates by date of onset. This is the peak as it is now. However, I actually think that it's okay. As I said before, I think that this will eventually be established as the new peak. So this is where I think the growth rates are pretty reliable. You see that it's about 0 on a long-term moving average. I think that's about where it's at. And unfortunately, I'm just not really seeing anything to suggest that we're going to see strong negative growth. And I'm actually seeing some policy decisions that I'm worried are going to actually accelerate this growth rate back again. If these mitigation social distancing policies are not continued, I think that this growth rate will actually go back positive again. So very important to continue to social distance, continue your hand washing. Do not just reopen without any kind of testing. That's really the mantra that everyone needs to have. Okay, so just a reminder, these growth rates right here. This is simply because this is based on date of illness onset. There will be new cases added to this area, and these growth rates are not reliable. So again, do not rely on those. That is not indicating that new cases are showing strong negative growth. It's just the nature of the date of illness onset chart. Okay. Just to bookend this, because this is going to be my last update doing the date of illness onset, I thought it would be nice to show you the chart as it started and as it progressed over time. Okay, so with that, let's go ahead and see what that looks like. So as you see, the days are being added as the time is moving along, and there we are. So that was the chart from my first day of reporting it on March 23rd all the way through April 16th. So there it is. And I hope that you enjoyed this. I do think that this did give us a head start to be able to say that new cases were leveling off before the actual new reported cases suggested that. So it did what I wanted it to do, but unfortunately this data set is ending, and I will be focusing on the state-by-state updates moving forward. So hope you all enjoyed this data series. I hope you will continue to keep following me for those state-by-state updates, and I will also probably be expanding into other areas of analysis with regard to COVID-19, and in the future probably other interesting items as well. But right now COVID-19 is just top of mind. So all right, with that, thank you so much for watching. Please like, subscribe, and click the bell icon to be notified, and please also share this video with anyone who may find the content interesting and informative. And I want to encourage everyone, please continue your social distancing and vigorous hand washing, and definitely let's all encourage each other and our representatives to be very intelligent about our return to normalcy. Again, thank you so much. Have a great day. I will see you soon.